Today, we are digging into a medical journal from all the way back in 1929 to uncover an incredible detective story. Seriously, it's got everything: a case of mistaken identity, a super high stakes surgery, and a disease so tricky it earned the nickname the Great Imitator. Our story kicks off in the last few years of the Roaring Twenties. So, picture it: Los Angeles, 1928. The city's booming, the decade is roaring, but inside the walls of Los Angeles General Hospital, a really baffling medical mystery is just starting to take shape. And this is where we meet our patient. She's a young woman, just 31, and we only know her by her initials, PM. She's been admitted to the hospital because she's completely lost the ability to move or even feel her legs. For her doctors, the clock is ticking to figure out what in the world is going on. Okay, so what exactly were the doctors dealing with? Well, the situation was escalating, and fast, creating this just terrifying clinical picture. Her symptoms came on with just horrifying speed. It started with some back pain, but that quickly turned into weakness in her legs, then a staggering walk, and then boom, complete paralysis. Her muscles were spastic and literally wasting away. She couldn't feel a thing below her waist and had lost all control of her bladder. But here's the thing: every single one of these symptoms was a clue pointing to one very specific place in her body. And this was the smoking gun. See, the loss of sensation wasn't just some vague numbness. It stopped at a perfectly straight, precise line across her back, and that line corresponded to a specific vertebra in her spine. For doctors in 1928, this screamed physical blockage. Something had to be pressing on her spinal cord at that exact spot. So, now that they had a location, the whole investigation zeroed in on one prime suspect. I mean, all the evidence seemed to be pointing to one single devastating diagnosis. And that diagnosis was a spinal cord tumor. It just fit perfectly. A single growing mass would absolutely compress the nerves and cause that clear, clean line of paralysis. It made total sense. Now, you have to give the medical team credit. They were thorough, especially for the time. They used all the best technology they had. X-rays showed her lungs and spine were totally clear, which ruled out certain infections or big injuries. A spinal fluid test actually confirmed there was a partial blockage, which, just made that tumor theory even stronger. And they tested for syphilis, which was a known cause of neurological problems, but that came back negative. So every test that came back negative just made the tumor diagnosis seem more and more certain. So what do? Well, they were left with just one option: a really dangerous, invasive surgery to physically open up her spine, find whatever was in there, and hopefully remove it. It was a huge risk, but it was her only shot. So on October 4th, 1928, surgeons began this incredibly delicate procedure. They went in fully expecting to find a tumor, but what they actually discovered in that operating room, well, it was going to change everything. Okay, so step by step, they very carefully exposed her spinal cord. And there it was, this soft, reddish-gray mass, right where they thought it would be. To them, it looked for all the world like a sarcoma, a pretty common type of cancerous tumor. So they quickly snipped off a tiny piece and rushed it over to the pathology lab for a frozen section, an immediate analysis, while she's still on the operating table. And here it is, the big twist. The phone rings in the operating room. It's the pathologist, and the report is just shocking. The mass that looked exactly like a tumor, that was acting exactly like a tumor, was not a tumor at all. It was something else entirely. So what was it? The real culprit was something called Coccidioidal granuloma. This is a disease you get from inhaling the spores of a fungus that, believe it or not, just lives in the soil in certain parts of the world. And what it does is it creates these lesions, these granulomas, that under a microscope look almost identical to the damage caused by tuberculosis. So what on earth was this bizarre disease? And why was it showing up in a hospital in Los Angeles doing a perfect impression of a spinal tumor? Well, the answer was hiding in the patient's own history. See, this disease, which people often called valley fever, was known to be strongly linked to California's San Joaquin Valley. And it turns out our patient, PM, had spent 3 years working in the vineyards of Fresno, right in the heart of that region. It's almost certain that's where she breathed in the spores. And this was a huge deal because back then, getting this diagnosis was pretty much a death sentence. And this is why they called it the Great Imitator. The disease was a true master of disguise. It could perfectly mimic other, much more common conditions, especially tuberculosis. It could cause lesions on the skin, in the lungs, and in the bones, just like TB. Even the tissue samples looked nearly identical under a microscope. It was an absolutely brilliant imposter. Now, Dr. Rand's 1929 paper didn't just talk about one case. It actually presented two, and the contrast between them is just so stark. It really highlights how devastating this disease could be. Okay, first, the incredible news. After the surgeons removed that fungal mass from her spine, patient PM made what can only be described as a miraculous recovery. Just 1 month after an operation for what everyone thought was a fatal condition, she literally walked out of the hospital. But then there was case number 2, a 38-year-old man, also from the San Joaquin Valley. His initial diagnosis was tuberculous meningitis, an infection around the brain and spinal cord. But when paralysis set in, they started to suspect a tumor. The final diagnosis, after he died, was the same as PM's, coccidioidal granuloma. But for him, the outcome was tragically different. The autopsy for that second patient revealed this just horrifying detail. The disease had wrapped itself around his spinal cord, as the report says, in a coat sleeve fashion. It's this powerful, chilling image of this fungus just slowly and relentlessly squeezing the life out of the central nervous system. So, after all of this, what did Dr. Rand and the rest of the medical community really learn from these two incredibly dramatic cases? Well, the conclusion they came to was a vital lesson for that pre-modern era of medicine. The number one takeaway was basically a giant warning sign. This disease, coccidioid meningioma, could look and act exactly like other, more familiar diseases. Doctors, especially those practicing in California, had to start being aware that what looked like a clear-cut case of a tumor or TB could actually be this fungal imposter. And this led to a really bold conclusion for the time. Dr. Rand argued that even though the surgery was incredibly risky, if the symptoms were clearly pointing to something pressing on the spinal cord, going in was justified. It was worth the risk. I mean, as patient PM's case proved, even when you weren't 100% sure what you'd find, that surgery could be life-saving. This whole story from 1929 is just a stunning reminder of the challenges doctors faced before things like MRIs and CT scans. And it really leaves you with a question to chew on, doesn't it? In an age before our advanced imaging, how many other diseases were out there acting as masters of disguise? How many other patients might have been lost in that fog of medical uncertainty, their true conditions hidden behind the face of a great imitator?